again. Welcome to our channel. I'm Alicia. Hopefully you've had a chance to watch the part 1 of chemotherapy. This is the part 2. As I recorded part 1, very soon after I recorded it, I realized there were so many things I didn't get a chance to talk about, and other things I kind of wanted to elaborate on. And so I knew kind of once I started recording part 1 that there was definitely going to be a part 2. And once I'm done with this one, maybe there will be a part 3. I guess we'll find out. But I did make a list of some things that like I said, I wanted to elaborate on, or things I didn't really get a chance to mention in the first video. So hopefully you've watched the first video. If you haven't, I recommend watching that one first. That gives you a better introduction to how chemotherapy was when it started, my chemo port, the different medications, the different types of chemotherapy drugs I was on, the different side effects, the difficulties with those, and the hair loss and things like that, the nausea, the pain. So like I said, if I look down a little bit every once in a while, I just have a list of things I want to make sure I don't forget to mention. I had time to contemplate a lot of this, one, over the course of like 3 years. But also since my last video, I realized, okay, I definitely want to make sure I can mention these other things in the next video. So I know in the first video I talked to you guys about, losing your hair, or when I lost my hair. And, for those of you, if any of you are watching who have been through chemotherapy, that, the hair loss. And for some, there is the emotional component, especially if you're a woman with very long hair. Losing all of that can be emotional. Especially because you're not choosing to. It's not like when you choose to get a really short haircut, you're not choosing that. And if you, like for myself, I buzzed mine. It was maybe like a few centimeters long before it fell out. So I didn't have that very traumatizing event of it all falling out in very large chunks. My hair was quite long. I know some women, that's what they do. They don't want to buzz their hair. And then even some women, or men too, there are treatments you can do before chemo to preserve your hair. Unfortunately, they're rather expensive and they don't always work. They do work for some people, and for some people who really their hair is really important to them, they will often opt for that. So that's an option for you. I knew that I was just gonna go with it. I just figured might as well you just lose all my hair. I'm kind of glad I did, also because the upkeep would have been exhausting. That was one of the nice things, is like, I was so exhausted all the time that not having to like shampoo or condition my hair in the shower, not having to like style it, or even basic things like putting it up in a bun, like I didn't have to worry about any of it. It was just one fewer thing I had to worry about, so that was nice. But so I know I talked about that in the last video, and I even talked about like the functionality of hairs and how you don't think about when you lose all of like your baby hairs on your face, and you lose your eyelashes, and like the functionality of like, my eyes were always watering, and like all your nose hairs, my nose was always running. And so I think we tend to forget, just as like people in the world, like there's functionality to like every part of our body, So there's that aspect, but there's also this other aspect that I didn't get a chance to touch on, which I wanted to say now, is that, and I think I mentioned this first part in the previous video, that people don't realize, because here's the thing is, when I buzzed my hair initially, and then months later when it started to grow back, everyone was commenting, "Oh, you look so cute with the buzzed head," and I kept it that way for a while because it was summer in Las Vegas, so I kept it real short for a while. I would get a lot of comments like, "Oh, you looked so good with short hair. You should, like, you can really pull it off," which was probably true. I mean, obviously that wasn't my choice, but I don't think people realize that. I know this is true for myself, and it's probably true for many other people as well. You look very different with buzzed hair than you do with no hair. Being completely bald is a very different like aesthetic. And so while I might have looked, cute with a buzzed haircut, I didn't look or feel cute when I was going through chemotherapy. And very few people saw me like, without anything on my head. I would wear a wig. I bought a lot of wigs initially right before I started chemo, thinking I would have fun with them. I was so exhausted all the time. Like, I think I wore them there were maybe like 3 days in like the 6 months that I was going through everything that I wore them. Like now recently, because I had them, sometimes I'll wear them just for fun. But during actually chemo, I usually just put a scarf or a beanie on my head because my head was cold. But I didn't want to have that. Didn't feel like getting, dressed up and stuff, or even just putting on hair. I did every once in a while though. But when I would go to campus, because you know I mentioned this before that I'm a PhD student, so when I would go to campus or go to work, I would sometimes just wear a head wrap and try to make it look professional so I could be comfortable. But sometimes I would wear the wig, but I usually had something on my head, so no one really saw that I was completely bald. And I would, for the most part, draw on my eyebrows. Now I think I mentioned this in the last video, like I still draw them on because they didn't grow back, which is common for certain areas of hair not to grow back. I was very fortunate that all my hair grew back. It grew back silver. I dye it blonde now because my hair is naturally like a medium brown, not anymore because of chemo. So that's not the end of the world. But my eyebrows, this eyebrow grew back about 70%. This one grew back about 25%. And so even when I don't have eyebrows, like you can kind of see like a shadow of this one, but this one just, it does not there. And so I draw them on now to obviously look, you know, normal. There was a couple points. I don't want to lose my train of thought. So the first thing is you know, people don't realize like how you look so different. And this was something that I dealt with. It was very difficult. Was, you know, looking in the mirror and like, you know, before I get in the shower, you know, being naked and looking in the mirror and seeing just my body being ravaged in multiple ways, but also looking, and this is the best way to describe it, I felt like I looked like an alien. I didn't have no hair on my body. I had no eyebrows, no eyelashes. And you don't really realize how weird your face looks when you don't have eyelashes. And I looked, first of all, I looked horribly ill because I was going through chemotherapy, but just that feeling of like not feeling like yourself, and like, you know, in your whole body, every system shutting down. But also, like, you can't even look in the mirror and recognize yourself. It's just, and maybe I let that get to me a little more than other people. I think, you know, every person's experience is very different. And it wasn't about an attractiveness level. It wasn't about that. Like, that was the last thing on my mind. But it was about, like, when you look in the mirror, you want to be able to see you. You know, whether you are having a bad hair day, or whether you feel like you look really great, whether you've lost weight or gained weight, like whatever it is, you recognize yourself in the mirror. But imagine over the course of just a few weeks, suddenly you don't know who you're looking at, and it screws with you, you know. And I knew it was me, but I felt like everything that was happening to me was horrible, was this kind of like alien experience, you know, this very foreign experience. And now I have someone in the mirror who I barely recognize. And it was just very, very difficult. So if you know someone who's going through chemotherapy, like kind of keep that in mind, that there's so much beyond, like the physical is so difficult enough, the physical side effects, but the emotional and psychological side effects are really difficult, you know. And it just, I still every once in a while I'll look at old pictures of myself, you know, going through cancer treatment, going through chemotherapy specifically, and I remember those feelings so clearly about how I felt. The other thing, kind of on that same note, is like I mentioned before, like most people don't realize, you know, how you really look, and I only let a few people really see me that way. I have pictures that, you know, I've shared with friends like afterward, but I only had, you know, maybe 4 or 5 people that were close to me who actually in real life saw me, no hat, no scarf, no wig, you know, and because it was difficult, you know. And also, here's the other thing I think we often deal with, whether you're a cancer patient or whether you are just dealing with some kind of medical issue, that you often have on you the burden of how other people are going to feel. Like I felt this way a lot, that I didn't want to make other people feel uncomfortable. I didn't want to put anyone out. I didn't want to make other people feel like that I was a burden, or that I had expectations that they were going to just not fulfill. And it's just, if you know someone who's going through chemotherapy, or I mean in general, like if you know someone who's going through something medical, I would say, this was my experience, it's better to say, this is what I'm going to do for you, than to ask them, what can I do for you? Because often we'll say, oh, nothing, I'm fine. In reality, there's probably like a laundry list of things that we really need help with. We don't know how to say it. And I was very fortunate that I had friends would tell me, hey, I'm coming over Thursday, I'm going to bring dinner, you know, or hey, I'm at Target, do you need me to pick up, you know, XYZ for you? And so they were very specific, and so I didn't feel like it wasn't like they were asking, hey, do you need anything? I didn't want to be like, yeah, do all this shit for me, you know. It was, this is what I'm going to do for you, you know, double checking with you, but this is what I'm going to do for you. And that was such a relief for me, you know. I was very very lucky that I had some really close friends. But back to what I was saying originally, people don't really realize what you look like. And this kind of goes to how people react to you when you're going through chemotherapy. So I had found out I had cancer, and I told my advisor, and then I, over the course of that week, let everyone else in my academic committee, a few people, I let them know, because I was concerned academically. Like, I had to let them know, hey, some like important things that I have coming up, like my comprehensive exams that I had planned for, like, in 2 months, that's not going to happen. Coursework, I'm going to try, but that might be a little more difficult. I can do some bare minimum to stay in the program, but I really have to put some of these major benchmark, events on hold. And they were all very understanding and amazing, actually. I felt like they were understanding as colleagues, and understanding as human to human. I definitely felt supported in that for the most part. However, in terms of like my overall department, I didn't feel that. And not that I had to be close with every single faculty member or every single other grad student, like, of course not. But I think I let those things get to me more so because I was going through this. And there was a time where I had told my advisor, and I told a couple of my close friends, and it wasn't a secret, and I told my committee. And so in my mind, after I had gone through maybe my third chemo treatment, so now we're 6 weeks, 7 weeks in, I'm assuming everyone just knows, because I didn't ask anyone to keep it a secret. And also I was on campus enough, but when I wasn't not there, but when I was there, I felt it was obvious. I felt that they could tell I was drawing my eyebrows on. They could tell I didn't have hair under my whatever I was wearing, or that I was clearly wearing a wig on the 1 or 2 times that I wore it. So I just assumed that they all knew just because of word of mouth, Well, one day we had a guest speaker come in, and I really wanted to go, and I was feeling like shit. And it was just one of those days where I'm like, I'm not putting a wig on. I'm not even going to draw my eyebrows on. Who cares? Everyone knows at this point. It's just going to be a bunch of my colleagues and friends or acquaintances. And if the occasional stranger see, who cares? At that point, I was like, I don't even care. I'm so exhausted. I almost didn't go, and I was like, I kind of wanted to go. And so I made myself go, and I had a sweater on and leggings, and then I had I put a bandana on my head. That was it. So it was very obvious. I didn't even wrap it. I just bandana from the side. It was very obvious I had no hair, no eyebrows on that day, sunken in eyes. I looked like classic chemo patient, And at that point, I was like, everyone knows it doesn't even matter. And I walk in, it's 10 minutes before this guest speaker, and we're all kind of getting our seats. And I walk in, and everyone turned and stared at me. And I was so surprised, and it was obvious why they were staring at me. And I just thought, oh God, I thought everyone knew. And I had a bunch of people afterward come up and talk to me I didn't know. And I'm like, oh gosh, I just thought everyone knew. And they're like, well, we didn't know. And then my advisor actually had a couple of the other faculty. He told me later, they had emailed him and asked, hey, we saw Alicia, what's going on? And I talked to him later. He's like, I just didn't feel like telling anyone. I'm like, well, I didn't think you were going to purposely tell anyone or not tell anyone. I just assumed everyone would find out. Anyway, so that was kind of a shock for me, and which it wasn't necessarily bad, because people were like, oh my God, are you, what's going on? Are you okay? But I did have a few people after that who to me, it felt obvious that they would avoid me once they found out I was a cancer patient. And I think some of that is they don't know what to say, they don't know how to say it, which is true. And I think at the time I was willing to give everyone the benefit of the doubt that was what was happening. Maybe we weren't super close, we were just acquaintances, so they don't really know what to say or how to say it. But I will tell you, and this is one of those things you process later emotionally, is the bullshit that you have to deal with. Why am I taking on everyone else's psychological shit? Why couldn't just be I'm fucking sick, please say hi to me, instead of all this other stuff. But because I'm the kind of person I am, I'm constantly taking on everyone else, oh, they didn't mean to, or they must have didn't know what to say, or I was constantly making excuses for people, which as a good person in the world, it's good to be empathetic and understanding, of course. But I think in the moment in my life when I had every reason to have zero empathy for anyone, it would have been then. and to just focus on me, not to be cruel, but just to focus on me. And I felt like even then I couldn't let some of that go. And later I resented it because I was like, fuck those people, because, they couldn't even say hi because poor them, they didn't know what to say to me. Meanwhile, I was dying. You know what I mean? It was just like, so I had a lot of anger about that later. And, there's really nothing you can do about it. It's not worth confronting someone like, hey, remember like 2.5 years ago when you saw me in the hall and you turned the other way and I didn't talk to you for 4 months when I was going through, you know what I mean? Like, what are you going to say? Like at that point, and this is another thing, is I really realized, I think, who my really close friends were and who weren't. And I had some people who I literally didn't hear from the whole time I was going through treatment. And I had other people who I would, before treatment, I would have said, oh, that's a kind of a friend, who became very close with me, who really were there for me. And so I learned a lot about like my social circle because of that. Okay, so, I guess to kind of stay on the same topic, also my family. Now, this is a big one, and I know some of them will be watching this. I'm assuming. And I've kind of talked about this a little bit with some of them, but this has been one of the hardest things, is how my family reacted and or treated me during cancer. And this was another thing. I gave everyone in my family the benefit of the doubt. And I think some of that holds true. I don't think anyone in my family is a bad person. I think a lot of it is they really truly didn't know what to do or how to say it. There was miscommunication about a lot of it. But all I knew at the time was that I felt alone, And so, I told you before that my mom, she was ready to like pack her stuff and move in with me, and I told her wait. But she ended up, while I was going through chemotherapy, she ended up, she would come and stay for like a week in that first week, and then go home for like 2 weeks, or like, a week, and then come back, stay for a week or 5 days. And so she was back and forth. And so she was with me, and I love my mother. But it was really hard having her here because I felt that I had to mother her. Now I was the patient. I was the cancer patient. And when my mom was here, it was all like, she was just like, oh, my poor baby has cancer. And so I had to be the one to comfort her because of that, and I'm not saying she didn't comfort me. My mom's a really good person, but I felt it was so hard. And also I think there's no perfect way to react to any of it. Like, no one's going to be perfect in that scenario. I wasn't, they weren't. I'm just telling you how I felt, and I loved having her here, but there were a few times where it was a little frustrating. Like, I felt like I really needed her to kind of take charge and do stuff, and I still felt like I was constantly having to like navigate a lot of our daily shit, and it just became like, I'm dying, please God, can someone else drive? Can someone else get the groceries? Can someone else start dinner? And I'm sure when she's watching this, she'll be like, oh, I couldn't stop Alicia, she was gonna make dinner no matter what, which is true. Like, I'm definitely like, it's hard for me to sit still, so I hear that. But it was difficult having her here sometimes, not all the time, and I definitely appreciated so much a lot of the stuff she did for me while I was going through treatment. But there were a few times where I felt like I had to comfort her instead of vice versa, and so that was difficult. Now, that's one person in my family. I do have a couple of family members who I'm fairly close with, and obviously you guys are watching this channel, Laura and I are really close, and so she and I we've been close since we were children, like 30 plus years. But other people in my family, I'm not super close with them, but I guess I thought during cancer treatment they would really rally around me, and that didn't happen, and that was very, very frustrating. It was very sad. It was very disappointing. So, I live in Las Vegas, and the majority of my family live in Northern California, and which is, 8 hours away. It's not very far. And so I actually currently I drive often to visit Laura or visit their family, and she will drive here and visit me. It's not that far. Or fly in, and my family would often travel to Vegas. Like, before I moved here, they would travel to Vegas for fun, like once a year, twice a year. And so when I started going through all this, I figured, okay, at a minimum, some of my family will come to visit me at least once or twice, maybe, during this difficulty. And they did not. And not even that, like, no one really reached out to me. there were, I want to be clear, like they did reach out and ask how I was doing on rare occasions. It's not like they ignored me. And I did receive a few gifts from some family members, which was much appreciated. But I think at the time I felt like it was so minimal, like to what I was, in compared to what I was going through. Now maybe they thought it was a huge deal to reach out or to send me a gift. And that's true. I'm not saying it was nothing, but it, compared to everything that I was going through with chemotherapy, it felt like the most, minimal effort they could have made. And, but at the time, you're just trying to get through it. You're just trying to get through every day, hoping that you can get through that day, and stressing about the next treatment and just dealing with the pain every day. So a lot of this emotional stuff doesn't come up until later, Well, fast forward to, I've completed all my treatment, chemotherapy, surgery, radiation, which I will talk about in other videos, surgery and radiation. But fast forward real quick to the end of all of this treatment, and I go back and visit my family in California, and they have a little barbecue get together because no one's seen me in over a year. And I finally get to see everyone, and by then my hair was just starting to grow back. And so if you hadn't known, you would think I had just shaved it. It was still, like, I knew that it was still a little patchy, but no one else really noticed it. It was finally starting to kind of come back, and I was finally starting to feel a little better. And just around, it was maybe like a month after my treatment, so we're at 6 weeks maybe, and I was just starting to feel a little better. I was finally feeling like that hint of like, back to I'm not dying, and I go home to visit my family, and I'm so glad I had that opportunity. And I really wanted to share what was going on with me. I wanted to share my journey, and at the time I was still dealing with it and processing a lot of it, but I knew that I had so much to say and so much to talk about, and I really felt like I could share this with my family, especially like my female family members who can relate to possibly what it's like to like have breasts and wonder if you're going to lose them, and all this other stuff. And no one really cared. My impression, my perspective was that no one cared. I wanted to see my scars. No one really wanted to hear me talk about it. Like, I remember us sitting at a table, and I started to talk about something about, I think it was surgery or chemo, and someone else just changed the subject. Like, in my mind, it was like, wait a minute, what the fuck? Like, I thought you guys were all here for me to celebrate me doing better, and you guys don't want to hear what I have to say. I just felt so alone again, and I was amongst my family. And the only two questions that I got from my family members while I was there, it wasn't, oh my gosh, the pain must have been so bad, how did you deal with it? Or, how are you doing emotionally? Like, is there anything you need? Or, tell me what it was like. I know you probably need to talk about it. Like, nothing like that. The only two questions that I got were, did you lose all your hair? And did you smoke weed when you were going through chemo? Those were the two fucking questions I got from family members. That was it. And I was almost disgusted, because it's like, yes, I did lose all my hair. Do you want to know what that's like? It's fucking horrible. Like, it hurts. It hurts a lot. Your skin feels like you can't, like, it's falling off. Meanwhile, like, all your bodily systems have stopped working. You can't hold any food down. Everything tastes like metal and snot. Every joint is an excruciating pain. You know what I mean? And I didn't smoke. I've never really been a smoker. I've always been a drinker. Smoking's not really my thing. I do it, on rare occasions. But I didn't do it while I was going through chemotherapy. Like I mentioned before in the previous video, I was very nauseated, but the antiemetics, the anti-nausea medication my oncologist prescribed, worked very well for me. So that was the thing I relied on. And so it was just like, I had gone through this horrible trauma, and I just felt like they didn't care. And I feel like I've definitely kind of held on to a lot of that anger since then, which I feel like I have the right to do. And I think that if any of them are watching this or have watched this, they probably are surprised. Maybe they didn't realize I felt that way, because I've never been one to really confront anyone in my family, especially about something like this, where it wasn't like they clearly did something wrong. It's just a matter of like perspective and miscommunication and misunderstanding. And I think I just felt like I shouldn't have had to ask. You know, I shouldn't have had to ask for my family to come visit me. I shouldn't have had to ask any of that. You know, later I found out that some of my family members said that my mom kind of downplayed how I was doing. I think, not in any bad way, I think she didn't want them to worry, but in her telling them, oh, Alicia's, you know, she's struggling, but she's doing good. She's doing good. I think that was her way of kind of keeping everyone upbeat about it. But I don't think she realized that it made everyone think I was okay when I wasn't. And so I think a lot of it was just miscommunication, which I understand. But all I know is in the end, I was left feeling like my family didn't care that I was dying, you know. Oh, okay. That was a big one. But it's important, you know, deal with the emotions. I wish I would have said something at the time. I wish I would have been like, where were you? Even if at the end we hug and they say they're sorry and I say, you know, I understand. I feel like so much of it I wish I would have said. Now I feel like if I say, hey, 3 years ago, where the fuck were you? Like, it's at this point, you know, I think it's something I have to deal with, you know, which I try, you know, it's still hard. I don't want to make this video too long and I still haven't gotten through like the other things. I'll just say, there was a couple things. So one, the weight gain and weight loss. So there's often this misconception that chemotherapy patients lose a lot of weight. And while that might be true, it's not really accurate. The majority of cancer patients actually gain weight during chemotherapy because we are often on some form of steroid to counteract many of the chemotherapy side effects. And so being on steroids, like I mentioned in the previous video, sometimes you would just be like gorging yourself. It's very common. And plus you're very sedentary anyway. And in fact, my oncologist said, we want to see you gain weight during chemo. A good 10 pounds is always really good because there's always a chance that suddenly you lose some. And we don't want you to be underweight. And so like anyone who knows me knows I'm not underweight, but I was slim, you know, very average, you know, and I was like up 10 pounds, down 20, up 15, down to, like, it was very back and forth, back and forth. At the end of chemo, I was about 12 pounds heavier than when I started, which was like obviously not like the end of the world, you know, all my clothes still fit. I was still basically the same size, but it was kind of difficult. It was like, God, my body, will it ever look the same? No, that's the answer. If you're wondering, it will never look the same. And then now, because of all the medications I'm on, I'll have a whole video on medications I'm on. It's just nearly impossible for me to lose weight. Like, I'll have a whole video about that. But, you know, I think also one of those things is like learning to have a new body. You know, if I'm always going to be 15 pounds heavier than I was 3 years ago, that's my new body, and I survived cancer, then that's just going to have to be what it is. You know, that's the least of my concerns. And it's not even about, like I said before, about the attractiveness, or it's just feeling like you don't have control over your body. Like, it's very difficult. And so, like I said, I'll have a whole video about the medications, but the weight loss, weight gain, you know, so if you see, so if you yourself are gaining weight, if you're going through chemo, or if you're losing or gaining, like, that's very normal. Obviously, if you have concerns, talk to your physician. And if you know someone who's going through treatment, it is normal to fluctuate, but it's actually more common to gain a little bit than to lose any. So wanted to kind of, you know, let you guys know about that misconception. The other thing was that I had, so when you're going through chemotherapy, your white blood cell count drops very low. Because basically chemotherapy it's killing in your body all of the fast growing cells, which is cancer, but that also includes things like skin, hair, nails, you know, a bunch of other things, which is why, you know, you lose all your hair. This did not happen to me, but I had women in my support group whose nails fell off, whose teeth fell out. I have some major dental complications because of chemo, but I didn't have any of my teeth fall out. But I had one of the women in my support group that happened to her. And so it's your all these things, all these different cells in your body are also being killed by the chemotherapy, not just the cancer. But so your white blood cell count is very low. Now, as most of you probably realize, this can be really, it makes you susceptible to like infections and stuff. And after they do really cautious about this, because this is what happened with me. This happens with a number of cancer patients going through chemotherapy, is that your white blood cell count drops very low, but it can drop even exceptionally low, even for a cancer patient, and this is called neutropenia. So this is what I had. I was neutropenic. And basically it just means that the white blood cell count is severely low and they have to boost it up a little bit. And so I had to do these self-injections. And the first one they did for me, but it didn't make sense because you had to do them like so many days after chemo. So I would go in for chemo. It wouldn't make sense for me to come back like 24 hours later because I had to drive really far to my oncologist. And plus you're like, feel like, just don't want to move. And so the first one they did, but then after that, every chemo, like 24 hours or 48 hours, whatever it was, I had to do the self-injection. And I had to do like so many, like, I think it was like 2 days after chemo, I had to do like 2 injections every time. And so I had to do them in my stomach, this injection. And it wasn't really that uncomfortable. Like, you get used to it, but it was just one more fucking thing. Like, one more needle in my body. And I'd have to like take a little alcohol swab and swab the area on my tummy and then do the injection. And for the longest time after that, anytime I smell, even now, anytime I smell like rubbing alcohol, my stomach starts hurting. I just feel like really nauseated because I have that, my mind just goes right back to that. And because that medication, like if you didn't know this, your white blood cells are created like in your like a narrow cavity, like in your bones, like in your legs. And so this injection, basically what it does is it stimulates that to happen very quickly. It wants your body to create a bunch of white blood cells really fast, and it becomes extremely painful. And so your legs will just ache like this is on top of all the chemo pain. So every time I do that injection, I just knew like the pain would wake me up at night. The pain was so bad in my legs. And so that, it was just one more thing. I think that's kind of it. I had a couple other things written down, but I think that I'll save those for a video when I talk about long-term side effects because those are aplenty. And we say, chemotherapy is the gift that keeps on giving. And this is totally true because I am, 3 years out from chemo, and I have long-term, long-term side effects. And not even that uncommon. Like one of them is kind of uncommon, but the other ones are fairly common. Like most people don't realize that chemotherapy doesn't end when you have your last treatment or 2 weeks after. Like maybe there are horrific side effects, but chemotherapy does often, and did for me, cause lifelong damage to my body that I have to now deal with. And so I'm pretty sure I'll make a whole video on like side effects, like long-term side effects. So thank you for watching part 2 of chemotherapy. Hopefully you've watched some of the other videos on our channel. Some like this are much more serious and emotional. Some are us being very silly and fun. So there's a wide variety. I really appreciate you guys listening to my story. I'm going to do another one on surgery. And like I said, I'll do one on radiation. And then I'll also do one on probably like the long-term side effects of all the treatment and medications that I'm on. Hopefully this was informative, and like and subscribe, and I will see you guys on the next one.